Plus, surviving cancer and having babies, the medical breakthrough in Chicago that could make that possible for more women.
It used to be that women fighting cancer had a reduced chance of getting pregnant, but these days, cancer survivors, they want to be mothers too. Tonight, Nancy Liu tells us about some Chicago researchers on the verge of helping patients get pregnant.
Inside this Northwestern lab is the future of fertility, some of the most comprehensive research to help cancer patients have babies.
So instead of cancer really being a death sentence, it's now one of those medical emergencies that you deal with on your way back to a healthy lifestyle.
Professor TERESA WOODRUFF is overseeing the study of a relatively new field called ovarian harvesting. Funded by the National Institutes of Health, she's attempting to have a woman's ovary removed, frozen, and then thawed when the patient is ready to have children.
That freeze-thaw process is probably the biggest hurdle we have to overcome.
So far, scientists have successfully completed the process in mice, not people. But that hasn't stopped 29-year-old Gail Meyer from signing up. As a 4-year cancer survivor and mother of an 8-year-old daughter, she was the first to volunteer for the program.
Because I want kids more, and even if I don't, somebody else could possibly have kids even after all this.
The technology is especially important when you consider that half the people under 45 diagnosed with cancer will receive treatment that affects their fertility.
What we want to ensure is that the cancer treatment is really confined to time, and then when they're ready to return to their normal healthy lifestyle, fertility options are still available to them.
The difference between ovarian harvesting and freezing an egg is the process requires less time, no hormone induction, and can be performed on children as young as 12 years old.
What this means for cancer patients is that it means A, survival from that cancer, and B, hope for the future, that their dreams of having children still exist.
Fertility expert Dr. Angie Belsos views the procedure as promising, but she thinks a drawback is learning how to thaw the ovary and make sure there are no health risks.
There's concern that that cancer could be reintroduced into the body once that woman was cured.
Breast cancer patients like SUSIE ARHANGELOS appreciate the possibility of more choices.
I would love for other women to know that they have options and not to give up. And even though you're focusing on the cancer, that there are options to have more children.
Plus, ovarian harvesting can be done in a day, so it doesn't have to interfere with their cancer treatment.
I think it's hopeful. I think there's good promise in it.
Women who sign up with Northwestern have to agree to allow 20% of her ovarian tissue to be removed for research. To hear what an oncologist thinks of the risks involved, just go to myfoxchicago.com and click on the Health tab. Nancy Liu, Fox Chicago News.